All right, we'll go ahead and get started. Thank you for being here for our COVID-19 vaccine media availability. On the docket today is Adam Parath from Renown Health, and we'll have James English and Kevin Dick from the Washington County Health District and the COVID-19 Incident Management Team. We'll start off with Adam, if you're ready to go. And I just had one update regarding COVID-19 vaccines at the Reno Sparks Livestock Event Center. We do have availability as early as Monday, plenty of appointments Monday if people are interested to get the vaccine. So other than that, I will head it off to you. Adam, if you're ready, please go ahead.
Great, thanks, Scott. Good morning, everybody. Renown has completed more than 70,000 first and second dose vaccinations to date. This week, community members 16 plus are receiving their COVID-19 vaccines through Renown. We're currently distributing the Pfizer and Moderna vaccines. We're well on our way to reaching our goal of providing the vaccine to everyone who's interested in receiving it at no charge. We currently have around 1,500 first dose Pfizer appointments available on Tuesday, May 4th and Wednesday, May 12th. Please log into MyChart or call 775-982-2781 to schedule an appointment today. Ongoing updates will be provided at covid.renown.org/vaccine. Thank you.
All right, appreciate that, Adam. We'll now go to James English from the Washington County Health District. James, if you're ready, please go ahead.
Good morning, everyone, and thanks, Adam, for continuing to be a great regional partner with all the vaccines you've provided. Here at the Washington County Health District's operations, we will exceed 140,000 doses administered before the end of today, which is a remarkable achievement. In our region, we've given over 311,475,000 doses as of April 27th, of which the health district in our operation has given 45% of those doses. I think that's really important to realize, and why the health district is continuing to operate our pod, because although vaccine is readily accessible and available throughout our community, a large number of our citizens continue to utilize both our drive-through pod and our homebound vaccination program, which is extremely successful. As I mentioned before, we are using the Janssen for our homebound vaccination program, but if someone does not want Janssen, we will make special arrangements to provide a different vaccine type. Furthermore, I'm very pleased with our vaccination numbers. We need to continue to educate our public and get people to continue to be vaccinated. Statewide, 44.75% of the state has initiated vaccines at ages 16 plus. Statewide, 31.2% of the population is fully vaccinated. But here in Washoe County, we've initiated vaccines on over 51.49% of the eligible population, and we've completed vaccines for over 32.14% of the population as of April 27th. So I again want to thank all the regional partners that have worked with the health district and myself in our operations to protect our community. With that, Scott, pass it back to you.
All right, thank you, James. I'll now pass it to the Washington County District Health Officer, Kevin Dick. Kevin, if you're ready, please go ahead.
Yeah, thank you, Scott. I just think I'll begin with how we're doing with our COVID-19 right now in the community. We're pleased to see that we're coming down from the increase that we had seen in new cases occurring per day. And our positivity rate is also now moving in the right direction. So as of the report yesterday, we're at about 36 new cases per day. And so we're back in the 30s like we had been previously, before we saw the increase, and that's important for us. The positivity rate down to about 6.3% positivity, so still above the 5% positivity that we'd like to see. But I'm proud of our county and the way people are behaving in order to continue to be stable at these lower levels. I would like to point out, though, that we do have surrounding areas, Carson City, Story, Lyon, and Churchill counties that are all flagged under the state county tracker for elevated disease transmission. So it's important for people to recognize that. and still practice the precautions to avoid transmission occurring here in Washoe County, as well as if you're in those other areas. I know the CDC has provided their guidance on outdoor mask use, and just wanted to remind everyone that while that is the CDC guidance, under the state's directives, there is the mask mandate that does remain in place. So that is what applies in Washoe County until such point as that is either relaxed or lifted. We are still seeing a number of the B117 variant cases that are being identified by the state of Nevada Public Health Lab through their genomic sequencing. So as we're seeing across the country, that is becoming a dominant variant of concern that we have here in Washoe County. The current vaccines have been shown, though, to be protective for the B117 variant, as far as either preventing you from getting COVID-19, or if you do, not having a serious case of the disease. So the vaccines are still very important for us, actually, particularly since we have those variants of concern. I guess on the vaccine, I did want to make sure that everybody in our community knows that now is the time to get vaccinated. I know there are some people that have, out of respect for others, that have other health conditions that would put them at higher risk of COVID-19. We do have members of our community that have held back so that everybody that's at higher risk had the opportunity to get vaccinated. So those people have had the opportunity. We do have vaccine available. And so if you've been one of those people that's been holding back so that you're not jumping the line in front of somebody that's more needy, I'd encourage you to get scheduled and get vaccinated at this point. I'm quite proud of how our community is doing with getting vaccinated. I was reviewing the numbers the other day and looking at Clark County and the Quad counties and Washoe County, and on a per capita basis, we are further ahead with our population getting vaccinated. I think people recognize that this is quite important for their community, for their families, for them to get vaccinated, and for themselves, as we can move toward more normalcy in our society and get our economy back open. And in regards to that, the plan will be, the local control plan will be heard again at the Board of County Commissioners meeting this coming Monday. And I'm looking forward to that plan receiving approval and moving forward to provide some additional relaxations of the restrictions in Washoe County, as we're continuing to move forward in a planned and cautious approach so that we can be successful as we move to June and going to 100% occupancy levels. So with that, I'd turn it back over to you, Scott.
All right, thank you, Kevin. We'll now open it up for a question and answer. We have Adam Parath from Renown Health, and then James English and Kevin Dick from the Health District and the COVID-19 response team. Please direct your question to one of those individuals, and I'll stop talking. Please go ahead.
Hi, James. This is Kenzie with News 4. I'm looking at the dashboard, and on your peak days, you were vaccinating almost 4,000 people a day, and now you're looking at about 2,800 a day. Are you concerned with the drop? Is it normal to see this kind of drop? Do you have any explanation as to what's going on?
We've actually cut back part of our schedule and haven't completely ramped up due to the Salesforce and the new scheduling platform. We're also continuing to monitor and adjust that. There is larger supply in multiple areas of our community, so therefore not everyone needs to come through our facility, and I think that's what we're seeing. But what I am pleased to see is that we have a very high rate of return for our second dose clinics. So right now in our morning clinics, we're really only scheduling about 600 to 700, which our plan was for about those numbers. And then our afternoons are usually second doses and are quite full. So right now we're running about 1,500 a day. There is not nearly as much demand just to come here. And we also went through much of our essential workforce that was pretty much directed to our facility, which is why we were pushing as hard as we could. But I think what you're seeing here is what you're seeing nationwide. But I do believe our community is doing a better job continuing to show up and schedule appointments. We continue to fill.
And it looks like, a couple of the big vaccine sites in Las Vegas are closing. I don't know if that's because of low demand. Is there any talks of doing anything like that up here?
The Washington County Health District fully intends to operate this pod throughout the summer as needed. We are working with our regional partners to pare down operations in other areas, and we're looking at some community-based vaccination sites. But as you can see, between Renown Health and the Washington County Health District, over 67% of everyone vaccinated in our community so far has come through one of these two locations. So we're working very closely, and we will continue to operate. We may not operate 6 days a week or double shifts. We are looking at that, but we will make sure we have vaccine readily available to anyone that wants it in our community.
This is Victor with 2 News. This is for Kevin Dick. This Saturday, Washoe County will be the only county in Nevada that won't be getting that local control for the mitigation plan. So what are the rules for Washoe County residents? And, you didn't endorse the county's plan. Why is that? And what is your position right now?
Yeah, thank you, Victor. The rules on Saturday will be a continuation of what the rules are now as we move into May. Will remain under the state's requirements until such time as there is an approved local control plan from Washoe County. And I would anticipate that that would occur on during the meeting on the Monday, May 3rd. At which point it would be submitted to the state, and I would expect that it would receive approval from the state. The Washoe County Health District, along with the city of Reno and the Washoe County School District, did not endorse the plan that the county commissioners had put forward. And that was because the social distancing requirement was removed from the plan during the Board of County Commissioners meeting. The meeting was held right after or even during when the state issued their Directive 44 in regards to the local control plans. And I think that that created some confusion around social distancing and whether it was remained recommended or not in the state. And so the plan that's being put forward will continue with the social distancing required in accordance with the CDC guidelines through the month of May, but it will provide for people to be able to operate without a capacity limit as long as they're providing the appropriate social distancing as the CDC guidelines direct. It'll provide some additional relaxations of larger party sizes to be seated at restaurants and in bars. It will allow for events to operate with larger groups of people, up to 10 seated together. It will allow for bar service as long as social distancing is maintained. Will allow for hot tubs and spas to be reopened. So there's a number of measures to loosen the mitigations required that are in that plan while we continue to move forward through June to be able to have more people fully vaccinated before we go to further relaxation effective June 1st with dropping the enforcement of all those other mitigation measures and going to 100% capacity while continuing to operate under the state's mandate for masks.
So just to be clear, when could we see that no cap on the capacity limits? Is it as soon as next week's or after June 1st?
It would be next week that there would be no limits on capacity as long as that local control plan is approved by the state. And but that would still require the 6 feet of social distancing. So that would be dependent upon a facility's available space and how they can design that as to what capacity they could achieve, because they will still be limited by that 6 foot social distancing requirement. Then effective June 1st, the social distancing requirement would no longer be in effect and would be recommended, but people could operate at 100% capacity.
Hi, this is Bob Conrad with This is Reno. A quick question for Kevin Dick. Just want to clarify the mask mandate. When you reference that, is that what's coming from the state or is that local?
That's under the state's requirements.
Okay, thank you.
Yeah, thanks for asking, Bob. Scott, if I could just maybe add one other thing. I wanted to thank Channel 4 for their coverage of the homebound vaccinations that we're doing and the effort that's being made to reach the homebound individuals. We do want for people that are homebound to understand that they do have the opportunity to get vaccinated. We're also continuing to conduct COVID-19 testing if people are homebound and need to be tested. So for anybody that needs that homebound assistance, please call us through our call center at 328-2427. Thanks.
If no one else has any questions, I have one more. What would it take for us to reach that herd immunity level?
Well, Victor, nobody really knows what that herd immunity level is at this point with the COVID-19. It's estimated to be somewhere between 70 to 80%. But the herd immunity level is also very much dependent on what the effective rate of transmission is. And that varies in different communities and even within subpopulations within those communities. So we're just trying to encourage everybody to get vaccinated. We do have vaccine available for everyone, and the more people that get vaccinated, the closer we can get to that herd immunity. It's important to recognize that if we have people that aren't being vaccinated, there can be pockets in our community if those people are getting together where there is no herd immunity and we continue to have the disease transmission occurring here within Washoe County. We also have seen the news globally of what's going on in different countries and particularly tragic right now, the situation in India. And so we're a connected global community, and we need to make sure that we're getting vaccinated here to be protected from disease that may be coming to us through travelers from other areas. And we need to also make sure that we're working to help the rest of the world get the vaccine so that we can really get to a herd immunity level or something that suppresses the spread of the disease through a global vaccination program.
Any other questions? All right, hearing none, thank you all for being here. This will be posted on covid19washoe.com later this afternoon. If you have anything further in the meantime, please feel free to reach out, and thank you to all of our speakers today. Have a good day.